Hey guys, welcome back to Medical Coding with Blue. It is Answer Monday. So I'm going to be recording the answers right now, and then I'm going to close this video out and do another video because I want to catch you guys up on some things that's going on and some questions that I got. I want to talk about them today. So I'm going to go ahead and do these now. Remember guys, these exercises are not official. This is just me as a veteran medical coder sharing what I know and hopefully fostering a more curious community of medical coders than we already are, right? So let's go ahead and get started. So the first question was, the patient has a history and physical indicating alcohol use. The patient reports drinking a half a quart of vodka a day. The provider recommends counseling for the patient's alcohol abuse. The code that I got was F10.10. Okay. Number 2, hemiplegia affecting the right side of an ambidextrous patient. I got G81.91. Okay. Number 3, the patient presents for pain management due to chronic pain related to the malignancy of the left breast. I got G89.3 and C50.912. Okay. Number 4, the patient has bilateral chronic angle closure glaucoma. The right eye is documented as moderate and the left is mild stage. I got H40.2212 and H40.2221. So anytime they have bilateral glaucoma, and in this case they had chronic angle closure glaucoma, you want to make sure that you're paying attention to that detail of which eye is which stage, okay? Because they have 2 different codes for that. So remember to keep that in mind. Number 5, the patient is a 36-year-old male who has a pancreatic duct stone. An endoscopic removal of the stone was performed. I got K86.89 and 43264 for the procedure. Okay. Number 6, the patient presents with a 6 centimeter, I keep saying millimeter, 6 centimeter gash wound to the right bicep after being struck in the arm by a bird's beak. Now, if you got an answer that is different from mine, that's okay, because I should have put more detail on this one. And when I was looking up the answers for it later, I was just like, oh shoot, I should have been more clear that this was a bite. Okay, so if you got something else, just chalk it up to my bad. So I got open bite. I got S41.151A and W61.91XA. Okay. Number 7, a 38-year-old female was cutting the grass on a riding lawnmower. She was subsequently struck by a snail shell in the face. She now has a black eye. The patient was evaluated with no further injuries. She was advised to apply ice as needed. So, just one little quick side note. A snail, because I looked this up, right, is a gastropod. It is like a mollusk, right? And its little soft body is covered, the shell is made up of calcium carbonate. So I just thought that was sort of very fascinating about the snail, you know. Did I look it up? Yes. But sometimes you have to make sure that, like, if it is like a bug or if it is, you know, an animal or something like that, you want to make sure that you're coding the appropriate one. In this case, I was not able to find specifically one for a non-venomous, getting struck by a non-venomous insect, because it kept leading me to bite. And getting struck in the face with the snail shell is not getting bitten by a snail. So I just got struck by other object, or contact with other object. So the answers that I got is S00.12XA and for the black eye, and then W22.8XXA and Y93.H2. That's for the grass cutting. Okay, it says landscaping other, so something to keep in mind. Even though it's grass cutting, you have to think it's landscaping, gardening. That's how they classify it in the book. All right. Number 8 is an old tear of the left knee, posterior horn of the lateral meniscus. It is M23.252. Okay. Number 9. The patient was fishing and presents with a 8 centimeter superficial laceration on the forehead due to being struck in the face by a fish that leapt out of the water. Superficial laceration was repaired with a simple suture closure. I got S01.81XA and W56.52XA. And for the simple suture closure, I got 12015 for the procedure code. So keep in mind when you're looking up those procedure codes that it does give you the range, the different ranges for the measurements on the laceration. So lacerations always have to have those measurements. Otherwise, you have to default to the lowest one possible, and you never want to do that, especially if these sutures can get more involved, like different layers and things like that. So complex closures, okay. So make sure that when you are coding that you always make sure that those numbers are there. And if not, educate your providers to help them to understand that this is very important, because it is the difference between, getting, if they're documenting fully and they're saying everything that they're doing, if they're not giving us the measurements, then we have to default to the lowest one. And you don't want to do that, especially if, they're doing a lot of work. Why did I not select fishing? Because I did not specifically state that the patient was fishing. He just got hit in the face with a fish. He could have been out just boating or canoeing. He could have been whitewater rafting. I don't know. So even though I'm the one that wrote it. So anyway, moving right along. Number 10 is a procedure code for bilateral ear piercing. Now, I picked this one because I said, when I was flipping through the book, because that's how I get my inspiration to do certain ones, because I try to give you guys different procedures to code and to think, okay, well, they would be able to find this one? Is this one more difficult to find? How would I present this one? So when I saw ear piercing, I was like, ear piercing? I didn't know that was like a procedure code. Anyway, but it is, and I got 69090 with a modifier 50 attached to it. So if you got that one, kudos to you. So that is the answers for Answer Monday. I will go ahead and upload this video now, and then I'm going to upload another video and talk to you guys about what's been happening and what's been going on. All right, so I will see y'all in a couple of minutes. Bye.